Serious Americans who have been treated in hospital for COVID-19. How much did they charge you? What differences are there if you end up in ICU? Also, how do you see your health insurance changing with the effects to your body post-COVID? Doctor here. Regardless of what eventual bill comes your way, you need to do immediately two things before paying a single dime. 1. Call the hospital and ask to speak to the billing. 2. Ask the following questions. A. Do you have a community program for people who cannot afford their medical expenses? Egg. Community care. B. Do you have a sliding scale fee? I promise they do. This adjusts your portion of the bill according to your income, which with your lost job or have low income could be close to zero. C. Is there a social worker I can ask about qualifying for how to apply for these programs and for Medicaid? 3. If none of this works, call back again in a week and ask these exact questions. If you get no answer, ask to speak to their manager or ask for an appointment in person to figure out your options. 4. If none of that works, don't pay it. Wait for it to go into collections and then call back and ask to settle the claim for pennies on the dollar. This may hurt your credit, but may protect your survival. Sorry anyone has to go through all of this, but you would be surprised how many patients I have told about this who end up with a very small bill or no bill after going through this. Anything the hospital forgives they will get as a tax write-off. In fact, for some hospitals to keep their non-profit status they have to give so much of this free medical care away. As a Norwegian with government funded healthcare, I genuinely feel sorry for you in the US. That you have to go through this sort of crap when you are in a situation where you may potentially have lethal condition. Stay safe. As someone who hasn't experienced American healthcare, I find this horrifying that you have to barter your health. I was in the hospital 10 days and my bill was $700, which was a lot cheaper than I thought considering the fact I was in the ICU a few days. I already have really good insurance, so it probably won't change. I've only really had some breathing issues since. Not covered specific. Be prepared for some bills in the future. I had to go to the hospital a couple years back and didn't even stay overnight. Just had some tests done and was monitored for a few hours. I got the initial bill pretty quickly, but then a few weeks later I got another couple bills, then several weeks later another bill, and so on for several months. Basically they billed the insurance and they did the dance they do, and as they settled on amounts I got the individual bills for each line item. Like I think my bed was on one bill, X-ray and some labs on another, EKG on another, R on another, etc. I ended up getting around a half dozen bills over the course of 6 or 8 months, which really messed with my budget for that time, because I had just assumed I'd get one bill and be done. And there was no way to find out how many more bills I would get, because they were still negotiating, and they'd bill me once they'd reached an agreement and could calculate my portion. I hope you just got the single bill and don't have to deal with that, but it might be a good idea to set aside a few $100s if you can, just in case. 12 days in the hospital, 6 days on a ventilator, 30 and healthy, upwards of $300,000. Insurance said they would cover 100% of COVID costs, but the hospital coded it as SARS not covered, so I'm currently arguing with billing overpayment. Sent to collections over the ambulance bill within 2 months. Still have shitty cover days and a numb toe, but going full time soon to cover extra costs. The CARES Act is supposed to cover medical expenses for the uninsured. NPR had a story on this on the 22nd of October 20. TriStar, like most major health systems, participates in a program through the Centers for Medicare and Medicaid Services in which uninsured patients with COVID-19 have their bills covered. It was set up through the pandemic relief legislation known as the CARES Act, but TriStar doesn't tell its patients that upfront. Neither do other hospitals or national health systems contacted by WPLN News. There's no requirement to, which is one of the program's shortcomings, says Jennifer Talbot of the Kaiser Family Foundation who studies uninsured patients. https://www.npr.org/section/10/22/942,412/hospital bills for uninsured COVID-19 patients are covered but no one tells them. Edit. Added full NPR story link. Edit. Wow, my first awards. Thank you dear strangers. As a low-income resident of Massachusetts, I have MassHealth, which is essentially universal healthcare. I didn't pay a single dime for my COVID care aside from $3.65 for an inhaler. I didn't get hospitalized, but even in the past, when I was, it didn't cost me a single cent. Edit. When I made more money, I still had MassHealth. The highest monthly premium I ever paid was $35, and I was making around $40k at the time. Wife had to get one of the free tests and got a bill. Covered test, $0 MD consultation, $200. Oh best part, she only saw a tech who done the swab, never saw the doctor. WTF. Nobody without insurance should be paying for COVID treatment. Here's a link that should help. No balance billing for the uninsured is permitted. Jesus Christ, I'm so sorry to everyone who has been taken advantage of by unethical / scamming ass administrators or providers. Eater, please stop gilding me and donate to a local food pantry or literally anything else, thanks. Or just copy the link and spread the information. Eater 2, please don't stop gilding. For visibility? Sorry, your Reddit awards are confusing. Thanks for helping spread this info. Good luck everyone. Please hang in there. My neighbor, on disability and Medicare, was on a respirator for 5 weeks, and in that for 5 months. Medicare was supposed to pay for it. They just got a bill for $40k. 2 elderly people on a fixed income. To make matters worse, her husband got hit by a car and shattered his knee, so he's in a wheelchair. And Medicaid didn't cover all of his expenses either. It makes me so mad. They worked hard for 50 years, paid their debts to society, raised great kids, and now they can't get the help they need. Edit to add. It seems the consensus is that the bill isn't really meant for them. It should be paid off completely or only have a small amount for them to pay, but either billing needs to be changed or they just should not have received the bill. I'll be speaking to their eldest child next week to let him know what's going on, and hopefully they will have one less thing to worry about. Thank you all for informing us. We had no idea as they've never had hospital bills before. Also, for the jackass who said it's fake, I mean, it's only really hearsay from my elderly neighbor, so, man. French person living and working in the US here, California. I'm under a Kaiser HMO plan, which generally means I get pretty fixed costs. Prescriptions are generally 10 over 20 bucks each. Doctor visits are 10 over 15. Same thing for exams. Some things are free, like all the prevention stuff, such as cervical cancer screening, etc. In July I started to experience symptoms: nausea, headache, body aches, mild shortness of breath. Doctor scheduled me for a COVID test and told me, if it gets worse, to go to the Day after, I can't breathe. Never happened to me. It was so bad, I couldn't walk anymore. Roommate freaks out and takes me to the They tell me my symptoms don't warrant being there, vitals seemed good, and send me back home. I get a bill for $500, of which I must pay $100. I was there less than 30 minutes and I never even saw a doctor. They had me wait in the entrance hall and a doctor called my phone to assess the situation and send me home. I know it's not crazy amounts of money like I've read here in other comments, but it still fucking sucks. After reading this thread, I really fail to understand how literally anything can be prioritized over fixing this broken piece of garbage you guys call healthcare system. It's fucking insane that getting sick will financially drown you and your family. It really sucks. As you can see in the comments, one of the largest problems in the American healthcare system is the sheer number of variables that come into play, whether it is covered or some other medical problem. Some will pay nothing, or close to it, and either count their lucky stars, or think that everyone else can have it that way, if only they make the right decisions, like I did. Others will pay a lot upfront with high monthly premiums, or will pay a lot on the back end with high deductibles, and let's not forget about surprise billing, like being charged for an out-of-network doctor, while at an in-networker, or both. There are many different problems, and we are often like the 3 blind men, each trying to describe what an elephant is by what they can feel. It is like a tree trunk, sturdy and round, says the guy who can feel the leg. No, it is like a rope, flexible and long, says the guy who can feel the trunk. No, it is like a large warm pillow, says the guy who can feel the body of the beast. And they are not wrong, and they are not right. / edited for spelling. It would cost me $200 a week to cover my family of 4 with a $5,000 per person per year deductible. So we go it alone and pay cash for everything, and we are saving a ton of money. Doctor's office visit is $56 cash. Using the Good Recipe app, prescriptions are very affordable. My Zoloft is $30-50 for a 90-day prescription. There is a place named MedExpress that we use for urgent care. They have a 3-tiered level for care. The least expensive is $130, and it covers everything from A to E tier 2, $150, covers A to N tier 3, $180, covers A to Z. Emergency room visits we make payments on. We've only had to do that once. For vaccinations for the kids, we go to the county health department. Vaccinations are almost free there. So far, and we have been doing it this way for about 5 years now. Our total out-of-pocket medical expenses are less than 1 month's worth of medical insurance premiums. Do we wish that we had universal health care like they do in the rest of the world? Yes we do. Edit. As for the ACA no insurance penalty, there is a box that you check. Insurance was not affordable, and you do not have to pay that fine. I went into the ER in late April for what I thought was COVID. I couldn't breathe so bad I couldn't make the walk myself from the parking lot to the ER door, and collapsed on the sidewalk. Was brought into the hospital in a wheelchair. Temperature of 103, O2 saturation under 60%. I was immediately quarantined and give a ton of tests, including a COVID test. CT scan and chest x-ray showed a single lesion in my upper left lung. Doctors suspected it wasn't COVID because the scans looked different than other COVID patients they had seen, but had to wait a shade over 24 hours for the official test to come back. Upon a negative COVID test result, I was kept in isolation for another 3 days in the ICU because they didn't know exactly what I had. While there they got my fever under control, rehydrated me, and kept me on oxygen the entire time. I was sent to the ER for a lung washing and sample collection. I forget the actual term, bronchio something. I was under for about 4 hours while they essentially took samples and pressure washed the inside of my lungs. Single worst procedure I've ever had, period. Once they determined it was a bacterial infection and not COVID, I was released from isolation and spent 2 more days in the regular part of the hospital. My time in the ICU was scary as damn it though. No contact with the outside world. I couldn't leave the room and couldn't get out of bed. If I fell, they couldn't get to me fast enough to help and get PPE on to protect themselves. I heard people in the other room screaming they couldn't breathe, although in hindsight, if they were screaming, that they could obviously breathe at some level. It was still terrible. I'm 40, in fairly excellent health as an avid cyclist and wake sports enthusiast. I work a great job as a mechanical engineer and have what I consider excellent insurance. I consider myself extremely fortunate in that regard. Here's the bill I've just recently, October 12th, for my treatment ending May 2nd. It's absolutely effing stupid. Total amount billed is over $42K. Insurance paid $800 ish, and I'm on the hook for $940 ish. The other $40K vanished as far as I can tell. Written off as some pre-negotiated terms between insurance and the hospital. I was also in an in-network hospital. Had I gone out of network, why insurance says I would have been on the hook for the first $40K of bills. Here's my bill for those interested. https://n27prck/1085345233-2.jpg. Moving forward through the year, the only real change to my care and health was a renewed focus on eating right and remaining healthy. I had a follow-up CT scan scheduled, but after discussing with my primary care doctor, I cancelled it instead of spending the $1,800 copay they wanted for it. Making health decisions based on cost is a race to the bottom, and is a leading cause of the healthcare problems this country sees. The insurance system in the country is so completely and utterly asinine I honestly don't even know where to start. Negotiated pricing, networks that limit who I can and can't see. Paperwork so deep you need a law degree to read it. The fact that I consider myself fortunate for having insurance at all is a huge red flag. Only by good luck do I have good insurance. I want to say it's because I worked hard, or this that, or the other reason, but that's stupid. I'm lucky, that's it. And a person shouldn't have to be lucky to get life-saving care without financial ruin. In my circle of friends and family there are but one or two that could possibly take a $40k hit to their budget and not be pushed into bankruptcy. And this was for 3 days of significant care. What about the remaining 362 days this year? Sorry for the long post, and I know it's not directly related to the question, but I thought it might be at least somewhat relevant, since it was a lung issue, in the middle of a pandemic, and I landed in the ICU for several days. That's the end of the video. Please press the subscribe button, and like the video, if you liked it. Stay safe everyone.